Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our weekly update for September 2nd, 2021. First of all, I'd like to thank Heartland Health Services for our new location for our press briefings. Our location previously at the Peoria City County Health Department has been moved because we need to expand it for our vaccination clinics in-house, which is a good sign that more people are interested and wanting to get vaccinated. With that, I'll start with our daily counts for the Tri-County. To date, the Peoria, Tazewell, and Woodford counties are at 49,360 cases. That is an increase of 804 cases over the past week alone. That brings Peoria to 25,087 cases, an increase of 361. Tazewell County at 18,890, an increase of 324. And Woodford County is now at 5,383, which is an increase of 119 cases. We now sit at 788 deaths to report. That includes 2 additional deaths in Peoria County, both males in their 80s. Right now, there are 1,212 individuals that are actively at home isolating with COVID-19 in our Tri-County. When we met last week, that number was at 931. An even starker contrast is last week reported 37 of our Tri-County residents were hospitalized. To date, 51 of our residents are hospitalized. Our 7-day rolling average is now at 115 new cases in the Tri-County each day. Regarding our cases, for Peoria County specifically, 30% of our active cases are between the ages of 0 to 19. And 17% of our cases are 20 to 29-year-olds. 48.8% of our cases are, 48.8% of our county is fully vaccinated here in Peoria, with similar in Tazewell County and 46 in Woodford County. Overall, the hospital systems of OSF St. Francis Medical Center, UniPoint Health Methodist, Proctor, and Pekin are reporting 18 total ICU beds in use, 62 non-ICU beds in use, and are reporting 5 deaths in the past 24 hours. Tomorrow, Peoria, Tazewell, and Woodford will move back into warning stages as we dip under the 20% capacity in our ICUs. To speak more about the capacity issues we are seeing in our hospital systems, today we have Jennifer Hopwood, Vice President of Patient Care and Chief Nursing Officer for OSF St. Francis Medical Center.
Good afternoon. As Monica stated, the 4th wave of the pandemic is proving to be much more challenging for hospitals and health systems to manage than the previous ones. Today at OSF Healthcare St. Francis Medical Center, we are at 90% capacity with only 1% of adult ICU beds available and 2% of adult med-surg beds available. These are routinely the most in-demand beds for our medical center. Over the last 4 weeks, we've experienced delays with admitting patients to our inpatient beds, causing further delays in the emergency department and procedural areas, and also accepting patients from regional hospitals who don't have the services to provide care to patients in those areas. At any given time, there are multiple patients waiting for a bed. Not only are we experiencing a lack of bed for patients, we're also experiencing workforce shortages similar to what's been reported across the nation. both with healthcare workers and other ancillary services that support our healthcare workers. Today, St. Francis Medical Center has 43 patients positive for COVID in our care. 32 of those patients are admitted to the general floor, and the remaining 11 are in our ICU. Pre-COVID, our general floors and our ICUs were very busy. We typically moved one patient out to get one patient in. What's different today is that we have never seen one diagnosis account for so many admissions in those areas for such a significant amount of time. This is what makes the COVID virus challenging for hospitals and health systems to manage, because there are other patients still sick and still requiring that care, and there are not enough beds available. COVID's using approximately 15 to 20% of our ICU bed availability on any given day, and about 8 to 10% of our available gen med space. Of the 43 patients who are in our care with COVID, 7 have been vaccinated. All 7 of those vaccinated patients are over the age of 65. 2 of the 38 patients who are unvaccinated have received 2 doses of an mRNA vaccine, but with the new FDA and CDC criteria for immunocompromised patients, they are eligible for a 3rd booster and they're considered unvaccinated. None of the 11 patients in the ICU were vaccinated, and 9 of the 11 patients in the ICU are currently on a ventilator. In the unvaccinated COVID patients, we're seeing more severe illness and higher admission rates related to the age of the patient and the presence of pre-existing conditions. However, we do have patients admitted with COVID that have no pre-existing illness. In regards to the age of patients with COVID in our care, currently there are 2 pediatric patients under the age of 17, 6 people are between the ages of 25 and 44, 6 are aged 45 to 54, 11 are between the ages of 55 and 64, and 11 are 65 or older. In recent weeks, OSF has been publicly transparent with the hospitalized COVID data across our entire healthcare system. These snapshots of data really demonstrate the effectiveness of the COVID vaccine, not only at reducing your risk of contracting the virus, but also at reducing severe illness and hospitalization if you do test positive. I'd encourage anyone who has not been vaccinated to consider receiving the vaccine, and those who are immunocompromised to seek their 3rd booster shot immediately. Reaching herd immunity by the majority of our public is what is going to end this pandemic. I'd encourage people to continue masking, social distancing, and using appropriate hand hygiene. You know, it's especially important today, but it's even more important as we begin to get into our regular respiratory season, where we start to see more viral illnesses such as RSV and flu that also account for increased admissions during the winter months. I'll open it up to any questions that individuals may have.
How would you compare the ICU right now at OSF, St. Francis, comparing it to November when we saw another surge?
So we definitely have not seen as many ICU admissions, but the difference, of course, is that the majority of the admissions that we're seeing are all unvaccinated.
How frustrating is it for you as a healthcare worker to see this current surge, know the vaccine's out there, and most people coming to see you have chosen, for whatever reason, not to get it?
It's very challenging.
Are you seeing any of the new variants that they've been talking about? Not just the Delta variant, but the other ones out there.
I'm sorry, I don't have that level of detail. Although I will say that the majority of what we are seeing right now is the Delta variant.
Are you finding that when people are admitted that they are more sick than they were previously due to?
I would say the severity of the patients who are COVID positive is the same level of severity as what we saw in the prior waves of the pandemic.
Have we hit the point where capacity issues are getting so strained that we're talking about suspending elective surgeries again?
There have been challenges with continuing elective surgeries. We have had to open additional surge space to care for patients, have really kept people in some spaces overnight that we don't typically do in order to keep our elective surgeries going.
What's a surge space?
Another area of the hospital that's not typically used for patient care but can be used for patient care.
Such as?
Keeping a patient in a PACU overnight, a recovery room.
And then you mentioned beds before, more people having to wait for beds. So in that case, when you're saying waiting for a bed, obviously, what does it look like when you're waiting for a bed?
Well, it could be that you're being admitted through our emergency department, and the emergency department physician has determined that you need to be admitted to the hospital, and you could wait in the emergency department for several hours for a bed to become available. Or because we are a tertiary care facility, one of the larger hospitals in our regional area, we accept a lot of transfers from smaller community hospitals and critical access hospitals, and we're not always able to bring those patients from those hospitals into us timely. They sometimes wait hours there as well.
Have you ever had a situation where obviously folks often come to you, as you just said, are you ever finding yourself saying, you need to go to this place because they have more room than we do? Have you ever found yourself doing that?
Yeah, every hospital is full right now. That's what I'm finding. Everybody's busy.
Has OSF had to say no to people who were out of the area? I know that there are patients coming from southern part of the state.
Yep.
Because they are completely full. Has OSF had to say, guys, we are full. We can't take care of ourselves?
Unfortunately, we've had to. It's not something that we like to do, but when bringing any patient, we have had to deny patients transfer here. Timeliness of care is very important, but making sure that we're bringing a patient in when we have a bed and the right resources, the care team, in order to take care of them is of the utmost importance. And if we can't provide that care, we want to be able to say no quickly and be able to get that patient to a place where they can receive the care.
How long are the COVID patients remaining in the ICU on average? How does that compare to the previous waves?
Unfortunately, I don't have that specific data. I don't believe that there's any difference in the length of stay for COVID patients this admission compared to COVID patients on prior admissions.
Are folks who are in the ICU now, you mentioned that there's more unvaccinated people. Are there conversations being had between care staff and physicians and the patients about, will they get the vaccine now? Are folks changing their minds at all, folks that are in the ICU?
I think our focus while they're in is to treat them right now, and receiving the vaccine for them right now is not of the utmost priority. It's to really help them get through their respiratory failure that they're experiencing. Typically when you're that acutely ill, a vaccine may not be the best time to administer it.
I believe, then, that you said, and I'm sorry if I didn't hear, that there's one or two people who have been through the, quote, normal course of the vaccine. They got the 2 shots, but because they are immunocompromised and they could possibly get a booster shot if they wanted to, they are now considered unvaccinated. Explain that to me, because it seems like they went through the vaccination process and you're calling them unvaccinated. Is that common, and are you finding that to be more?
So the third booster was just approved by the FDA a few weeks prior,
right.
And so the CDC changed their definition of fully vaccinated for patients who meet specific immunocompromised definitions. And if patients are immunocompromised, they really need that third booster shot to be able to be considered fully vaccinated by the CDC's definition. And so those 2 individuals that are in our care right now hadn't yet had the opportunity to receive their third booster shot prior to contracting COVID, and so they're considered partially vaccinated.
Okay, they're partially vaccinated.
They're partially vaccinated, but really to become fully vaccinated, they have to complete that. They would have to complete that third booster shot.
Now,
I I would just encourage anybody who thinks that they may be immunocompromised to reach out to their provider and determine if they are, and to seek that third booster shot.
Now, is it the same thing like it was for the 2-shot course, where you have to wait two weeks after you get your third booster to be considered fully vaccinated?
I believe the recommendation is 28 days after their second dose of the vaccine to receive their third dose.
Okay.
If I get one last question, too. Tim asked about, your frustration. You mentioned it was challenging during this time. I'm curious, how is your staff handling this time, knowing there's a vaccine out there and you're seeing a time similar to what November was like?
Yeah, I mean, I think it's different for every healthcare worker. I mean, we have healthcare workers who are struggling with acceptance of the vaccine themselves, but, for many, there is a medication, a vaccine that's available out there that would prevent a lot of this illness.
Jennifer, given the space and the resources in the hospital are as taxed as you kind of brought up here, is that going to have to lead to other policy or procedural changes to how you do things long term, or is this just a short term problem?
Well, I think the national workforce shortage amongst healthcare workers, specifically roles like nurses, nursing assistants, and respiratory therapists, is probably going to be a problem that's with us for many years to come. With the COVID pandemic, we've seen people leave the workforce early. We've seen people opt for earlier retirement. We've seen people just choose different professions altogether. And it is challenging to take care of COVID patients day in and day out. I think that we are going to have to respond long term to how do we provide care with the resources that we have and still attain high quality and provide for the utmost safety for our patients.
I was talking more in terms, too, of things like elective surgeries, the way you're using the space, how long people wait,
Yeah.
that sort of thing.
So I think it's challenging with elective surgeries. We have a lot of people who, have been waiting for elective surgeries for quite a while and are experiencing pain. And, you can only put off an elective surgery for so long before it becomes a bigger problem and could result in an admission to the hospital. So, it has to be done with balance. As far as people waiting in the emergency room, the creating capacity on the inpatient side is the best thing we can do to speed up our timeliness of care in the emergency department.
Before I jump into questions, just one more comment too. Many of you have noted already the community-based testing site. We've been working with the state for over a month on this to reopen the Civic Center site. Rick Edgar and his team at the Civic Center have been just wonderful supporters of this. I just want to actually take a moment to thank the advocacy groups out there that have helped us reopen this, in the Peoria leadership in specific. Mayor Ali, Chairman Rand, as well as Peoria County Superintendent Beth Kreider, Peoria School District Superintendent Dr. Karat, and of course Representative Jahan Gordon Booth, because they really spearheaded this effort to really push us and get us opened as quickly as possible. So again, a great Peoria leadership to come around and really bring this forward. It will be open beginning tomorrow. It is a Monday, Wednesday, Friday, Saturday operation, and it will also offer vaccinations on site as well. So again, it is a free COVID-19 testing and vaccination clinic at the Civic Center, and it is in the Fulton parking lot where it was previously, and it will be from 8 to 4 on those 4 days.
Will it close during, let's say the AJRs in town, during major concerts, will it close during that time, or will it stay open throughout the
So,
conflict?
depending on the concerts at the Civic Center, that is completely separate. The testing site will continue to operate those 4 days. They may close for federal holidays, as they had previously, so that's just something to note. But again, they are not going to be impacted. And I think, again, Rick Edgar and his team at the Civic Center was in great communication with the state when they put this forward, and so they kind of understood what those capacities are. Likewise, a lot of concert and venues are wanting to make sure they are closely by a testing site and a vaccination site so that more individuals can participate in those type of activities.
Is that the National Guard staffing that again?
So the National Guard is not staffing the community-based test site. They actually nursing contractual program that the state has, so it will not be a Guard unit. It will be a contractual service from IDPH, or the Illinois Department of Public Health.
Hi, well, it has been a very long time. You might have heard the news that they found a new variant out there, the Mu variant, and there's talk of the Lambda variant that's wreaking havoc in the southern hemisphere. As someone who's focused on public health like this, what are your thoughts on these two new variants, on the rapid rate of mutation, and what advice do you have for anybody other than please wear a mask and get vaccinated?
So there's a lot to unpackage in that question, but I'll first start off with the end part, which is what to say to people. Getting vaccinated and wearing a mask isn't kind of a small feat. That is actually the biggest thing, the strongest thing that you can do to keep yourself safe and keep your community safe, is to get vaccinated if you are eligible and to continue to practice social distancing and wearing a face mask. So when we say, like, is it just the same thing? It's the only thing. It is proven over and over again to work. And so I think we can't discount it as some type of like tertiary or kind of like, oh, that'd be kind of nice for us to do. Really, at this point, it's almost a must. And to that point, that's how you get ahead of these variants. You know, what do I think about Lambda, Mu, or we can go down the alphabet all the way to Omega, is that the virus is doing what the virus is supposed to do. It's supposed to mutate. And the way it mutates, it finds a host. So again, the best thing we can do is stop transmission of this virus so that we don't see these variants pick up pace or keep spreading. The virus is, again, acting like a virus. It's following the same playbook that viruses have followed for eons, right? It's our job to be smarter than that. And the best way we can do that is to get vaccinated and wear a mask.
Of the COVID deaths we've seen, the ones that you mentioned the past week, do you have any statistics on how many were unvaccinated?
No, I don't have that data point with me. But similar to what Jennifer mentioned and what we have kind of in our own understanding, our primary cases, unvaccinated individuals, by far, over 90% of them are unvaccinated. The crazy part about it is, I mentioned that 30% are under the age of 19. It's, if you look at the data a little bit closely, 13% we would say of that 30%, so about a little less than half of them, are not eligible. So again, if you think about all of our cases in whole, right, you're looking at 87% of our cases have the ability to most likely get vaccinated.
Does something need to be done above your pay grade to try to get that age group eligible?
Excuse me?
Does something need to be done above your pay grade to try to get that age group eligible?
It's timeline. I think when, and a lot of people ask, like, when will that group? And it's data. We want to make sure that this is a highly vulnerable population. We're talking about children. We're not going to cut any corners on this. And so we want to make sure there's a robust data set. I think the Pfizer CEO came out and said they're really looking at end of October, early November. And there's also a process. There's an FDA approval process, and then there's what's known as ACIP, okay, the advisory committee. They have a meeting and a review cadence as well. I think the next time ACIP meets is going to be, right before September 20th, and hopefully from that advisory we learn more about that kind of widespread booster program, or the third vaccine, so to speak, for a lot of those entities. Maybe it's 8 months out. Usually is what people are talking about.
When I was just talking to Tim prior to this, and we were talking about that very first press conference that we had at Unity Point 18 months back. We talk about the fatigue. We talk about this, how this goes on. You just said that the virus is doing what the virus is supposed to do. How difficult is it for you on a personal level, or even on a professional level, to know that there are things within our grasp that people just are not doing, and do you ever get tired of saying the same thing?
I always get tired of saying the same thing, both professionally and personally. I have small children. I think Jennifer said challenging. It's frustrating. It is challenging. It's frustrating. It's also very sad. We've talked about vaccine hesitancy as a spectrum. There were people that were, calling us every day as soon as they announced the vaccine was available, right? Just asking for it, trying to figure out how they could be first in line, just everything they wanted to do right. You have groups that, as we've gone through, we've addressed the different levels of hesitancy. Some of it was just, I didn't want to be number one. I may want to be 100th, 200th, down the road. We've kind of worked through this process. Oftentimes people will say, like, I'm not interested because I don't know if there's enough data out there. There's a lot of data out there. There are, pages upon pages of peer-reviewed data on there. I think what's frustrating for me is that media, social media, even people kind of just resharing stories that are inaccurate, conspiracy theories, there's a lot of information out there. So I think what's frustrating for me is that everyone knows that the vaccine works. And I'm still concerned or not understanding, both personally and professionally, how something that is proven to be so effective is not being utilized. And so then I'm here back to weekly updates, partly to see all of you again as well, no doubt. But it's the challenge of it. I think I would like to be able to have activities, things that go back to normal. I think we want to have other things go, because right now part of the issue that happens is that we but we started putting in the back burner other health priorities at the same time. And so my concern is that we've been fighting COVID, and as we should be, but it's frustrating because we know that there's still bigger problems to solve out there, and that don't have a vaccine to solve it. And so that's why I can't balance that with that available, how we are still in this situation.
And probably it's been asked before, but in terms of vaccines, those who are immunocompromised who need a booster shot, obviously Pfizer has gotten an approval. Those who receive Moderna, the 2-dose, or the Johnson single dose, can they go and get a Pfizer booster, or should they wait till their brand name has gotten the booster?
So first and foremost, it's the mRNA vaccines that are eligible for boosters. So it's not just Pfizer, Moderna also has it. So it's the mRNA family of vaccines that you can get the booster. And you need to get the same vaccine that you got your first round. So if you received Pfizer for your first 2 doses, your booster is going to be Pfizer. If you had Moderna, you're going to go and get a Moderna. Johnson & Johnson has not released or extended their booster program. They, again, are hopefully in September with ACIP and all that guidelines would be in that grouping, fingers crossed. But or booster if you're immunocompromised. Both of our hospital systems, they've actually done a lot of outreach with their patient base, knowing the high-risk population to make sure they're coming in not only for their first, second, but now even their 3rd shot. So again, there is many ways for you to get this vaccine, especially if you are looking for your booster.
You mentioned that the virus is doing what the virus is supposed to do, but in the past, pandemics have risen, fallen, they've come in waves, they've peaked, and then they've just petered out. This, it seems like the rate of mutation, probably in part because it is an RNA virus, is at a much more rapid rate than it would be for another family of viruses. You went to school for this. Talk to us about this rapid rate of mutation.
So I don't know if necessarily the rapid rate of mutation is specifically for this type of coronavirus that we're seeing, but I think we have to put it in the historical lens. This is a time that we're seeing a pandemic in a situation where I can get way across the world in a day, right? We are a much more globalized society. We take airplanes, we travel a lot. We're, the boundaries don't longer exist like we had with Spanish influenza. And so, when I say the virus is doing what it's doing, it's mutating. Sometimes a strand can mutate and just die out. Other times it can have the winning lottery and then keep multiplying and spreading. And so I don't necessarily know if you can say that, is this just mutating faster as what we saw in previous pandemics? No, because we're in a different landscape as a world. We are a globalized entity, and so what impacts us in the U.S. will be something that impacts you when you live in Europe or South America or Africa or Asia. We have to stop kind of thinking of this as location specific, but just if it's in the world, it's everywhere. One last thing before I go, not related to COVID, but equally important, as I mentioned, that every 3 years, the Tri-County region, which includes Peoria, Tazewell, and Woodford, as well as the hospital systems of OSF St. Francis and Unity Point Health, come together under the Partnership for a Healthy Community. This organization is a collective approach to identifying and addressing the health priorities of our Tri-County. We are starting our assessment for the next cycle. Our current assessment identified 4 health priorities: mental health, substance use, cancer, and healthy eating, active living, and we've seen great efforts in all of these areas. But it is time to reassess, and the best way we get a lot of information is through surveying our community. So you can visit our website, actually any of those entities' websites. There's a press release that Diana and her team has pushed out, but we just asked residents to please complete this survey. Your voice matters. Your answers help drive how we as a region approach health and what priorities and what programming we bring forward. Again, we want to make sure we serve our public, and we recognize that the data that I collect, the data the hospitals collect, that's just one layer of it. There's people that don't necessarily access us, and we want to make sure that their opinions, their understandings of what impacts their health are heard, and that we can work to address that. So again, that's the Partnership for a Healthy Community, and their website. The survey is available both in English and Spanish, and also do not be surprised if you see this come to you from a variety of platforms, not only from the healthcare community, but from school districts, business community, even our libraries are all participating in this, because again, we want as many people in our Tri-County to do this survey. So again, if you can please share that, we'd really appreciate it. Okay, thank you.
Thank you.